Jeremy, it's looking like we have all of our presenters on. Do you want me to go ahead and get started?
That'd be great. Thanks, Tammy.
All right, welcome again to everyone who's joining us. If you haven't yet, please just introduce yourself in the chat. That's how we're going to do introductions this morning. But good morning, everyone. My name is Tammy Britton, and I'm the Homelessness Coordinator with the City of Grand Rapids. I'm happy to be joining you for a Fuse update this morning. I want to take a moment to recognize and thank the city manager and any city elected officials who have joined us, and a thank you to other city staff for being with us this morning as well. When it comes to Fuse, there has been a lot of good work that's been accomplished that we will be sharing with you this morning. The city is committed to supporting Fuse because it's an evidence-based approach, helping communities break the cycle of homelessness and crisis among individuals who are high users of emergency rooms, jails, shelters, and other crisis services, and we value that work. Fuse, which is an acronym for Frequent Users Systems Engagement, is an initiative from the Corporation for Supportive Housing, or CSH. We will hear from them next. CSH is a national organization with experience implementing Fuse across the country. So in Fuse, supportive housing is the solution. Supportive housing combines affordable housing with wraparound support services, and that stabilizes a person's life and reduces their returns to jail, homelessness, or hospitals. So with a similar mindset, the City of Grand Rapids is focused on addressing housing and homelessness and stepped into the role of Fuse champion. So as the champion, the city takes on a big picture role in the initiative. This includes supporting all of the phases from planning, implementation, and the upcoming evaluation phase, offering leadership, identifying opportunities for partnerships, coordinating data asks and matches, addressing barriers to supportive housing, and tracking progress to update the community. So we know the outcomes in Fuse will be unhoused residents gaining access to supportive housing, and in turn, the same individuals will have reductions in returns to homelessness, incarceration, hospitals, and other crisis services. Fuse is already at work in housing people in our community. We'll hear more about how many people have been housed so far later in the presentation. So before we go any farther, I'd want to give a brief recap on what the agenda is. The agenda was sent out via email, but what we'll go through next is we will review the Fuse concept and timeline. We'll hear from Kim Keaton at CSH on this topic. We'll also have a Fuse update from Jeremy Giroux, the CEO of Dwelling Place. We'll have an update on how Fuse and another community initiative built for Xero are connected and both operating in our community. That'll come from Courtney Myers-Keaton, who's the director of the Coalition to End Homelessness, or the Continuum of Care. And then we'll have a next steps discussion with Jeremy and Courtney. With that, I want to say welcome again, and I will turn it over to Kim Keaton, Director of Data and Analytics with the Corporation for Supportive Housing.
Thanks, Tammy. So I'm really happy to be here today. As Tammy nicely set up, Fuse is a national initiative that stands for Frequent Users Systems Engagement. CSH, or Corporation for Supportive Housing, for those who aren't familiar with us, we're a national nonprofit with about 150 staff located all over the country. We have some staff in Michigan, although I'm actually not located in Michigan. I'm in Kansas City, Missouri. But from my position as Director of Data and Analytics, I have helped more than me and my a bunch of other staff here at CSH have helped more than 40 communities over the past 12 years implement supportive housing for frequent users using the Fuse planning approach, which combines data-driven prioritization, multi-stakeholder engagement with housing first supportive housing. I am putting the link to our Fuse website in the chat, and you'll notice on that website, if you look at the map, Grand Rapids is included on our map of Fuse communities that we've worked with starting in 2020. Next slide. So who are frequent users and why is it important to target supportive housing for this population? Frequent users are people who have periods of institutional involvement between bouts of homelessness. So they're in healthcare settings, and that could be inpatient physical hospitalizations or psychiatric inpatient or substance use treatment. Also, they are frequently incarcerated and bouncing between the streets, shelters, et cetera. This institutional involvement means they can be missed by the systems we have set up that prioritize chronic homelessness for supportive housing. So just a tiny bit of background, chronic homelessness needs to be, there's a federal definition, and if you're institutionalized in healthcare or a correctional setting for 90 plus days, it resets your time as that you need to, the clock, so to speak. So that's why that's a barrier. The siloed service provision in each of these systems allows for frequent use to go undetected, and there's very little care coordination or warm handoffs between systems. When CSH works with communities on Fuse, each community uses data to look at the overlap between systems and then determines from that the definition and measures by which they'll define or make folks eligible for Fuse. So Grand Rapids has used high utilization of healthcare and homelessness resulting from a match between state Medicaid and the HMIS data. And they are seeking justice data as well, and actually had an update this week that data match is moving forward. So that's good news. Next slide. CSH has a 10-step planning approach for Fuse. So I believe we kicked off, it was like one of the last in-person meetings I had pre-pandemic, and we kicked off in January 2020 in Grand Rapids. And these are the steps that we typically work with. Grand Rapids has obviously identified project manager and champion at the city level, and then they assembled the cross-systems planning team, executed a cross-systems data match, created a supportive housing pipeline to get started. They're still working on securing evaluation resources to look at sort of the impact and outcomes of the program, although we're setting it up so that can be done. And then they've created a referral process and are in the process of, providing, doing in-reach to shelters, et cetera, outreach to folks and leasing up. This is all part of the implementation, and the monitoring and support of that implementation is ongoing. And really the subject of the meeting today. The road ahead for Grand Rapids includes determining scaling needs and mechanisms for Fuse. This could include creating more units and more financing for a scaled Fuse approach, and or sort of doing prioritization in the city's coordinated entry system to prioritize people with high system utilization for supportive housing. Next slide. So within the implementation that's going on right now, I've been privileged to be able to participate in the cross-systems case conferencing that's happening. One of the things that's really important to note is that cross-systems case conferencing or cross-systems contact is super important for frequent users, for programs that really are trying to prioritize frequent users, because Fuse eligible folks have a variety of system touches across homeless systems, healthcare entities, treatment, corrections. So because that's how they experience our community, our cross-systems implementation needs to mirror that and have folks from a variety of different systems around the table. And that cross-systems implementation with a housing first approach is a nexus where these systems can converge and improve outcomes for the group we're trying to serve. As part of this effort, there's a lot of what I call barrier busting that needs to happen. Folks who have been bouncing around systems have a lot of things that are preventing them from becoming stable. So that's trying to help them get documentation, creating lower barriers to entry to housing for people with legal system history or people who have active substance use issues, et cetera. And then another thing that's been happening is the teams have really been, you'll hear more about this later, but have been discovering and solving some data issues that have prevented FUSE eligible people from being properly documented as, or as having shelter stays or being able to really compile their homeless history. And so, what we've discovered is that there's a real, continued need for coordination across systems. So the ability, for an example, is the ability to share names across teams, cross coordinated entry, across outreach teams, helps us all get around the table and be able to share what we know about the people we're trying to find and engage. And then there's also a need for care coordination across systems. So in particular health and homelessness that can help align services for folks once housed. And so that's the viewpoint from my seat, and you're going to hear a lot more on the local implementation and from the local teams now. And I'm going to turn it over to Jeremy.
Thanks, Kim. Maybe before I get started again, I just want to thank everyone for being here today. Appreciate the chance to share an update on this FUSE initiative. Want to make sure we kind of all are on the same page in terms of what FUSE is and kind of why we started to look at this. And it's a little hard to read the room in virtual settings here. So just want to kind of pause and let anybody either voice a question or concern or put it into the chat right now, just to make sure that we're all on the same page of kind of this effort that is really geared around identifying people that homelessness is causing them to have medical conditions and medical issues and contributing to increases in jail stays or other interactions with the police department. And that's really the kind of the core audience is we're trying to identify and work with people whose homelessness is causing significant challenges in their life and find ways to prioritize housing for those individuals. At a very high level, that's what FUSE is about. And so we've been blessed to work with Kim and the Corporation for Supportive Housing here in Grand Rapids for a couple of years now as we look at how can we do a good job and improve our processes around these things here in Grand Rapids. This work really started at least for Dwelling Place here in Grand Rapids in 2018. Denny Sturdivant, my predecessor here at Dwelling Place, was kind of looking at challenges facing downtown Grand Rapids neighborhoods and some of the issues that we were facing here in Grand Rapids, and identified a couple things that needed to be done in order to make progress. One of those was around how do we address an increasing homeless problem that was already starting to become more prevalent and more obvious and challenging in 2018. Obviously, that challenge was even exacerbated over the last few years with COVID. But the work around this really kind of started around that time, in which case the public sector consultants were brought in to start having some community conversations to say, how can we do a better job of addressing the needs that are here in our community right now as it relates to homelessness? And that led to us engaging with the Corporation for Supportive Housing, which were kind of national experts on this FUSE model, which was really about targeting kind of this particular segment of the population that was really deeply impacted, where homelessness was causing them to become sicker, causing them to be involved with the justice system in different ways, and kind of focusing on that population for both because those individuals were deeply and significantly impacted by their homelessness, but also recognizing that population was, there was a cost to our entire community of not housing those individuals, in that, housing people in a jail or housing people in an emergency room is an expensive way to provide housing for folks. And if we can kind of solve this challenge, we are also kind of improving systems outcomes across the board in multiple ways. And so the FUSE initiative kind of was being explored in 2019. And in 2020, we kind of came together. I think many of you are here today, were probably invited to that meeting or participated in that meeting. But it launched with a large gathering of folks from Grand Rapids to say, hey, what would it look like for us to really explore this initiative as a different or as a new or as an additional approach to addressing homelessness and increasing the number of families that we are housing here in Grand Rapids. And so that kicked off in January of 2020 and kind of led to the work that we're going to be talking about here today. And again, obviously it's not forgotten that right around that same time is when COVID started to cases started to rise. And so this broad community effort of bringing people together to solve these challenges was done within the context of a pandemic that kept us from getting together in person for almost the entire time that we were trying to roll this out. It probably slowed down implementation some and impacted us in different ways, but it is nonetheless, despite that, we've been able to kind of start to make progress around housing this population here in Grand Rapids. Go to the next slide. Thanks. So in 2021, we started the work of saying, if we want to address and house this population, what does this really look like for us to do? And the start of that work was to get information on individuals that had these high needs. And so we were able to start by getting information from the state on high Medicaid users and use that as one of our measures for those who are most impacted with health issues around this and prioritization. And so we were able to get lists of people that had high cost for Medicaid, people that had frequent emergency room stays, and we're able to use that as a baseline for our kind of data match system, right? And the question became, who are these individuals? How are they connected with homelessness right now? And how do we make sure that we increase the housing rates among these individuals so that we can better address their medical concerns, right? It kind of makes sense that when people are struggling to find stable housing, it's harder to address long-term health issues as well. And so there's a natural overlap and a reason to believe that providing stable housing will result in better health outcomes for these folks. And so we were able to kind of get that information from the state. And one of the first things that we learned in that process is that there was a lot of individuals on those lists that we did not have frequent interactions within our HMIS data. So within our homeless management information system, where all those that service providers are touching folks, there's a lot of new names on the list, which was a sign that we're not connecting with everybody that we ought to be connecting with in our community, and that we had room to improve. A lot of that was around communication and data systems, so we can better identify all these individuals and know who they were. That work was going on. We started getting the names of folks and doing that work in 2021. Another thing that allowed us to pilot this initiative was that Dwelling Place had a permanent supportive housing project that was going to be under renovation and coming online. And so we anticipated to have a lot more vacancies within permanent supportive housing than typically happens for a development here in Grand Rapids, which gave us an opportunity to really house a lot of people in a short period of time here in Grand Rapids in our permanent supportive housing. And so that was a Ferguson project. And so that project started to have go into lease up in 2021 as well. And so we were able to kind of start to reach out to folks that were on this high Medicaid list, right, on the frequent users list, that were also chronically homeless individuals, and provide a housing opportunity for them. And so as that work was going through, when we got the name list, we identified that we had some challenges around kind of knowing everybody that was experiencing homelessness and knowing how to connect with those individuals. And when we started to move from that process into how do we house these individuals, it also highlighted some of the challenges that we have or opportunities we have as a community to house people faster by having shared information around documentation, right? If you move into a federally subsidized housing unit, we need a lot of paperwork on you. And there's nothing we can do to avoid that. That's federal regulations, but right, and not surprisingly, for folks that are struggling with homelessness and spending a lot of time on the street or moving frequently, don't maintain all their papers and don't have all that information readily available. And so we had work to do to really, if we wanted to go to house people quickly, to coordinate our system of information sharing so agencies can share that information with each other to get people housed faster. And so those were some of the things that we've been learning as we're going through this process of what are these barriers to really getting people into housing. Thanks for moving to this slide here. So again, as we've kind of gone through Fuse for implementation or piloting this for the last about year process of trying to move people into housing, or a little in 2021, we've identify these barriers around data sharing and data prioritization, and making sure that we have coordination on a referral process, so that the individuals that we are trying to reach can really be effectively reached in a timely manner and moved into housing as it becomes available. as you can kind of see, we were able to successfully house 16 individuals from the list during this time. We had about 40 vacancies to work from. So almost half of those vacancies that were dedicated for permanent supportive housing and people with chronic homelessness went to people on this list, which is right. I don't know if that's a good solution or a good outcome or a bad outcome. That's just kind of where the process started for us. And that's why I know we do the pilots. We think there's room to improve on that over time. We were able to kind of address some of these barriers that we're finding with some kind of systemic solutions, right? It's not just about kind of getting the person in front of you into a house. It's about how do we make sure that as we go through this, we kind of remove these barriers. And so part of the solution to that was to kind of do a 3-year look back on our release of information. Chronically homeless individuals qualify based on 3 years of homeless history. And so having this new way of kind of releasing information across organizations with a longer look back period allowed us to more quickly move people into housing and really shorten the time of documentation gathering. And like I said, we were able to house 16 Fuse folks in housing during 2021. We are now in the process, and kind of where we are ending right now or starting 22 is about doing a updated data match. So the state has a pretty decent system in place where they will be able to provide regular updates to the Medicaid information of individuals that are using that. We're working with Courtney and Salvation Army, and the coordinated entry process is looking at kind of how do we have a systemic way of connecting that data with our by name list so that we can quickly update that on a regular basis. That a lot of that had to be done manually originally and was pretty time consuming. And so we're looking at some more efficient ways of doing that work and are expected to start doing that this month. We've also had some really positive conversations with the police and jail, and we'll be able to start to integrate justice information into this process too, probably maybe as early as this quarter already, but definitely by next quarter to be able to have not just the medical information, but also that justice information available for prioritization. So, right, for an initiative that has been going on for about 2 years during a pandemic, we've really been able to kind of learn a lot about how do we connect with each other effectively, and right, and it's not surprising, maybe this was known before, but one of the lessons and takeaways from this is that housing Fuse participants takes a lot of coordination, right? There's no one organization that can do this well, and no one person that can do it on their time, on their own, that it really needs to be a community-wide effort and a collaborative initiative across multiple agencies and really entire systems of folks in order to kind of make sure that the right people are identified, the right people are contacted, the right information is shared, and that we can move people into housing as quickly as possible. It does not happen on its own, and it cannot be one organization doing this in order to make it work. Another lesson learned in this process is that prioritization of high needs individuals is dependent upon a coordinated entry system or a by name list that is accurate and pretty complete, right? We identified there was a lot of people that we weren't connecting with in our community by looking at a list of the Medicaid information of who was all experiencing homeless from that side of the things. And there was just a lot of gaps there. And so that, again, speaks to both the need for coordination and the need for the improvements that have been able to kind of be happening and underway in our coordinated entry system are increasing our capacity to do this well as we go forward. I think another lesson learned is that it does take organizational leadership at the table in order to do this well. Right, we sometimes think of case conferencing efforts as working, right, frontline staff or whatever word you want to use to describe the people that are working directly with individuals every day. And they are aware of the barriers, but they don't necessarily have the organizational leadership or authority to change organizational policies and procedures in a way that resolves the issue long term. And if we want to do case conferencing well, it has to be not just about helping individuals who are experiencing homelessness right now, but it has to go to the question of why did this person fall through the cracks in our homeless system, and how do we resolve those cracks and make improvements to those and remove those so we don't keep having individuals that need kind of specific conversations around in order to get into housing, but that the system is really working well to connect people naturally and consistently to the best housing opportunity available for them. And that takes organizational leadership at the table. So like I said, one of these lessons learned was around the need for a coordinated entry system, and that has been work that's been underway here in Grand Rapids, right? Not because of the fuse, but because that is just important work that's going on. And so I want to turn it over to Courtney to talk about Built for Xero and some of the work that is going on there.
Good morning, everyone. And Jeremy, thank you for that introduction and for that high-level overview. I think that was really well said. I do want to take just maybe a couple of minutes to acknowledge some of the questions that have come through the chat, because I think that those might be something that everybody has questions about, and it'll just give us an opportunity to discuss it really quick. So I noticed that one of them was just about like who's being served, or what is the distribution of either race, ethnicity, or ages. And I will say that, you know, with the 16 total that have come through, I'm not quite sure. I think that we can easily pull that though, and we can develop a dashboard that would be able to present that information, because all that data is captured. As far as the typical distribution, Kim, I think that you stated it really well, that it tends to be, you know, over 40s, middle age range for that distribution. And then as far as those who are undocumented and facing frequent use, would they qualify? You know, that kind of depends on the resources that become available. So it doesn't mean that they cannot come through the system and have access to any resources and to supports, but it does mean that there might be some specific regulations that could be barriers depending on the funding source of that resource. So LIHTC sometimes has specific barriers, as well as certain permanent supportive housing projects that might come through HUD. But that doesn't mean that they can't necessarily access anything at all. And so they should still be counted and be coming through the system, so that we can ensure that we're able to have discussions about how do we better serve those individuals who are undocumented too. I'm trying to see if there's anything else in there that I missed. I know that there was a question about those who've had systemic issues with legal concerns and evictions. You know, that's a little bit more on the prevention end, and I think a conversation well worth having, not necessarily within the scope of the work that we are talking about today. But Joyce, I think you know, that's definitely a conversation that we have frequently at the Continuum of Care, and I would encourage you to become involved there, and also for us to maybe connect one-on-one too. And I'd be happy to provide you with an update on that. And then I did notice just a comment about those who don't use HMIS, so some concerns about clients not being counted. I think this is where the by name list comes in, and it is really crucial for us to have solid partners around the table that know how to ensure that the individuals that they're serving do get access to the system and are counted on our by name list. So I'm going to talk a little bit more about that. So Built for Xero, what is it, right? Like, what is this connection to Fuse that we've been referencing? And some of the partners that have been engaged with Fuse are also already engaged with Built for Xero. And Built for Xero, just so you know, it is led by Community Solutions, which is a national nonprofit. And it's really a movement of more than 90 cities and counties that have committed to ending homelessness for entire subpopulations. And so we know in our community that we have reached what is called functional zero for veterans through the work of community rebuilders and the community. And that we had this opportunity come to us through some conversations that had been had with the foundations and at the Chamber of Commerce. And Dan Meyering of Trillium Investments came forward and said he would like to support Kent County becoming involved with the next cohort of Built for Xero at Community Solutions. And so he provided the funds to support our involvement with this cohort for the next 3 to 4 years. And so we are engaged with a network across the entire country where we talk about some of the best practices, the challenges that we have, and really focus on that systems engagement. And rather than viewing this as a standalone initiative, it becomes part of the water that we swim in. It becomes part of the changes in the system that we are creating, as opposed to it being just an add-on value that we're looking to create some sort of program or a service delivery. It's system-wide. It's about engaging with everybody who is working with those individuals who are experiencing chronic homelessness. And then as we started becoming involved, there was a lot happening at that time. This was in April of 2020, I think, that maybe we became a cohort, or maybe it was 2021. It's hard to say for sure. I feel like because of the pandemic, everything's kind of that our timelines are a little skewed. When we became involved as a cohort, though, we started recognizing that there was a lot of crossover between Built for Xero and Fuse. And so we wanted to start identifying how do we embrace this as a system and really make sure that the conversations that we're having are at a high level and include everyone instead of having a siloed approach. So I'm going to give you a little bit of a background of what the Built for Xero approach is, and then we will talk about how it connects with the Fuse approach and where we see ourselves going from there. So next slide, please. So what we are trying to accomplish is creating a team structure and change some of our norms to drive improvement. We're looking for some issues that we might have technically within our data system or perhaps data quality. Jeremy referenced some of those earlier when we started recognizing that we had some glitches with PSH, that's permanent supportive housing, for those of you who aren't ingrained in this work. Some referrals for permanent supportive housing last fall. Map our current flow of person level info through our system, map the coordinated entry process. We are reporting data points to Built for Xero so that we can have a solid dashboard that we are able to look at to see what trends we are identifying throughout this process. And it allows for us to have really what we're calling an actionable, and this is acronym, BNL stands for by name list, BNL report, as well as identify what we have on our by name list scorecard that we need to still improve upon. And so these are tools that Built for Xero has offered us through our work as a cohort with them. So this BNL report that I'm referencing, a scorecard where our team reviews this information every time we meet, and we look to see what needs to be updated and what are some of the next steps that we need to prioritize. But before I get into that, we're going to talk a little bit more about the structure of the work together, and then I'll give you a sense of who our Kent County team is. Next slide, please. All right, so as I mentioned, is we do meet very regularly. Our structure is that we already have monthly whole cohort meetings. So that means that we're meeting with the teams across the country to engage in learning opportunities, have discussions with each other about what's working, what we've been trying, what we might need to what we can learn from each other and try in our own communities, and really learning just about the topics that are related to establishing a high quality by name list and some other key foundations for improving our by name list process. We have one-on-one facilitated team exercises where we meet with technical support from Built for Xero, small group coaching. Also, that's once a month, and then data coaching and capacity building. And so it sounds like a lot, because it is a lot. We're all engaged in these various conversations. And what we started recognizing is that we have a lot of people in a lot of the same similar conversations. And that was why we felt it was really important for us to connect this work together. And if you go to the next slide, I'll give you an idea of who's involved in our team locally. So locally, our Kent County Built for Xero team is comprised of the Continuum of Care, or the Coalition to End Homelessness. We have representatives from the City of Grand Rapids, Pine Rest Street Outreach, Dwelling Place, the Salvation Army as our coordinated entry lead agency, Mel Trotter Ministries, Community Rebuilders, Degage Ministries, and Network 180. And so, as you can imagine, a lot of these same parties are also involved in the conversations around Fuse, also involved in some of the conversations around our coordinated entry. And we started just seeing that there's a lot of crossover, and we felt that this is a good opportunity for us to talk about how do we not just combine the work that we're doing, but incorporate it at a systems level. And before I get to that, I'm going to talk a little bit more about the benefit of a by name list and how it will connect directly to Fuse. So let's go to the next slide, please. So some of the value is, if you haven't inferred yet is it gives us a real-time understanding of who is currently experiencing homelessness in that population. So right now I can pull up a report that tells me how many individuals are currently experiencing chronic homelessness. And as the COC, I actually have access directly to their information. Now, we have data sharing agreements, so not everybody can see all those names on that list, but those names do exist, and I could name them by individual if needed. We also have significant outreach provider engagement and policies. Those are really important so that we can understand how people are added to the by name list, when it's determined that they become inactive, the different situations that might occur. So whether that's they become housed, they become inactive due to just inactivity in the system, we can't reach them anymore, or we find out that they are no longer here locally and have moved on somewhere else. We have to have policies around that. And then how do they get added back to the list when they come back into the system, or if they come back into the system? And then it also gives us an idea of how many of those individuals that are on our list are also being referred and accepted into different housing supports. And locally, I will say that we actually have a really robust outreach team. We've recently adopted those outreach policies thanks to the work of Built for Xero. That was one of the first steps that we took upon ourselves. And then we worked on creating that by name list in HMIS, and that's the Homeless Management Information System for those who are not as heavily involved with COC work. And with that by name list, that's where we have access to that real-time information on those individuals. And I will say that, are there things that we can improve upon? Absolutely. But we now at least have baseline level data, and we are able to increase the quality of that data as we move forward. Next slide, please. So it helps us to understand what the true scope of current homelessness is in our community. A lot of times, communities will reference their point in time count, and that is a really helpful baseline measurement. And if you're not familiar with the point in time count, it is usually conducted in the last week of January. It's a single night count of all the individuals experiencing homelessness in that community. Our region is Kent County, and actually our point in time count was shifted to February 23rd because of Omicron this year. We received a waiver, but we do have reports on our website and homelessnesskent.org that provide some information about previous point in time counts, including the demographic breakouts that I know that some of you have referenced. Now, the benefits of that is it gives us an idea, from year to year, how is that changing over time? But what it doesn't tell us is what is the ebb and flow throughout the year. And so by having a quality by name list, we can create that, and we can understand how people move through the system over time. And it gives us real-time information about the inflow, the current numbers, and the outflow of our system. And it also gives us a sense of what else do we need in our community to be able to support the individuals that are actively homeless, and how do we triage support to those who are most vulnerable as well. Next slide, please. So the work that we have embarked upon is really making sure and through defining quality, we are reaching quality. So we want full coverage. So that means that we want, more than 90% of agencies and programs that their primary population are those who are unhoused or experiencing homelessness, that they are involved and that they know how to add individuals to the by name list, and that they also ideally have access to HMIS. We have person level data, and that means that we know that where they are, their history, their health, and their housing needs, which, health and housing needs, that directly relates to Fuse, as Jeremy was discussing, and that we can see what each person's status is and understand their journey through the system. That we have regular updates, so that we have a list that is updated at least monthly, standard protocols in place, and that as people's status changes, so does their entry, so that we have an accurate representation of what that flow is, and we can rely on that data. So we do expect some variation between actual and expected levels over time. However, our goal is that we are able to develop this quality by name list and even improve upon it further as we continue this work. Next slide, please. All right, so what is this connection to views then? Well, as was mentioned, is we have to be able to know who is experiencing homelessness in real time in our community. And Jeremy had referenced that, one of the things that we had been experiencing is we didn't have a solid data match. There were people that were being sent to us from the state that weren't necessarily represented in our system. And so we needed to understand what was happening there. Was it an issue within our system and how data was being captured? Were they not making it to the front doors of our system? And if not, why not? So we need better data matching. And in order to do that, we have to have better coordination. And that comes through that system level coordination. And included with that, we want resource matching for those households, whether that's housing, supportive services. They need to have access to resources. And then this gives us an opportunity to better understand the population needs. And so when we've continued having these discussions between Built for Xero and Fuse, we recognize that there's significant overlap, not only between the parties that are involved in these conversations, but between the different work that was happening. And so moving forward, we realized that it would be better to have this under one umbrella, and as opposed to looking at these as separate initiatives that are siloed in our system. So we're looking at this as a way to really launch a system-wide initiative that embraces ending chronic homelessness built for Xero, but also include some of those Fuse components, because we know that those are individuals who really have some significant needs that aren't necessarily being addressed if we don't have the appropriate prioritization or necessarily have the system-wide case conferencing that's needed for them. And that will kind of launch us off into the next phase of our discussion, I think. So we're going to pause here real quick before we talk about some of those next steps to address any questions that there might be. And I haven't been able to read the chat while presenting, so I apologize. I might have to catch up.
Joyce asked a question in the chat that I think we're attempting to answer, but might need a little bit more explanation. So I'm going to read this out loud, and then Courtney, you could respond to it as well. I found in the field of social work, I've encountered many people who struggle with being able to obtain housing consistently. Are we building additional tools into the homelessness process to encourage and develop life skills improvements for one to move beyond the history of homelessness and to become self-sufficient? And will there be a future goal to target special groups, such as those who have experienced recidivism with hospitals, prisons, and hostile encounters, which would include human trafficking?
All right, so we have a couple questions in there, Joyce. Thank you for those. I do think that it would be helpful for us to have a conversation offline too. I will say that some of what you are referencing is really about that prevention work and upstream strategies, which I think that what you will see is I don't know if you were part of the Housing Stability Alliance at all, but some of the work that they are doing will focus on some of those indicators that you are discussing. And I think that there is definitely a connection to the continuum of care. But as we're talking about, the case management, so development of life skills and et cetera, there's a certain level of case management that may or may not be provided to individuals who are currently unhoused or experiencing homelessness, depending on their needs, and keeping in mind that there's a level of autonomy that we want them to have in their journey of homelessness. And so we tend to focus more on a progressive engagement model. And some of those things might be included, but not necessarily always. And so there's not one specific answer that I can necessarily give to that. And as we talk about homeless prevention, I think that is about the need for having more access to prevention resources. And that's something that we've identified as a system and as a community that we know is needed. As far as a future goal to target special groups such as those who've experienced recidivism with hospitals, prisons, and hostile encounters. You know, a lot of that actually relates directly to FUSE. So the recidivism with hospitals and prisons, I think there's that direct FUSE component there. And then hostile encounters such as human trafficking. They're actually, I would say that yes, there is a goal for that. We know that HUD supports those activities, and that as a COC, we also prioritize those who have either are DV survivors or might have had experience with human trafficking.
All right, we've got another question here. So how is this working, in particular points of access and data collection being coordinated with other homelessness organizations using data, trying to close the gaps in access, et cetera, with the exception of the housing organizations that were previously listed?
With Built for Xero, all of the information is collected through the Homeless Management Information System. And we have a pretty high coverage rate in our community of those who are providing services to those experiencing homelessness using HMIS. Now, the one thing that we have to make sure though is that sometimes even outside of that scope of work, there might be people who need to get access to the system that may not know how. And so we have to do a better job of communicating what is the method of ensuring that individuals are added to the by name list so that those individuals aren't missed. And so there are certain data elements that are required in HMIS that have to be captured and will still be captured through this. So I don't know if that answers your question specifically, but it is all being captured within HMIS for the Built for Xero. As for FUSE, Kim, you can probably speak to this a little bit better than I can about the data matching component, but it also is run through HMIS, but we also have like a statewide Medicaid database that is used for matching. And then with the data that is coming from, is it the county jail, Tammy? It comes through
the Kent County Sheriff's Office, I think.
We are anticipating arrest and jail data in 2022. Yeah.
So all of that is cross-referenced through HMIS. And if there's information that seems to be missing, or names that appear to be missing, then it's the work of community providers to identify how do we reach out to those individuals so that we can capture their information within our homeless response system too. And Kim, you can correct me if I'm wrong on any of that.
No, that was good. I mean, I think if folks think back to that Venn diagram that I shared at the beginning of the presentation that showed jail use, healthcare, and homeless services, the point of putting these data sets together is to see who's at the center of that Venn diagram and who's got utilization across these three systems that we could focus on for the intervention of supportive housing. And so that's how the data is used. I mean, that's the point of the data match, is to ensure that we're not just looking at one system's use, but rather across.
I think one of the things that we also learned in the last months is that the importance of not just collecting that data, but making sure the data is being pushed out to the right organizations at the right time, particularly our outreach team. We found ways to kind of share some reports over the last few months that really allow our outreach workers in our community from a few different organizations to have better access to information of who was kind of potentially qualifying for housing units, so we could expedite the process of identifying those individuals and moving them into housing in a faster way. And so, yeah, I do, again, HMIS is the center point for kind of gathering this and bringing all the information in, and then finding good internal or community systems to make sure that we're pushing information out to the right people at the right time is the other challenge that we need to. We have room for improvement, but we've already made some progress on here over the last while.
Yeah, thanks, Jeremy. Other questions before we move on to some next steps?
Thus far, what do you see as the factors that have been the most important in stimulating and supporting the continuum of care development?
Is there a way to reframe that, perhaps? Because I'm not sure I'm not sure I understand how to answer that directly.
Maybe Crystal, you can come off mute, or I don't know if folks can.
If that person wants to unmute, you can go to the lower left-hand side of your screen and unmute. And why don't we answer this other question in the meantime? So does HMIS flag persons who meet a particular set of criteria to then be referred into the FUSE program? This is what Joyce is believing that she gathered from the explanation.
No, so I wouldn't say it flags it and then refers. Referrals happen based on the resource that becomes available. So different resources have different qualifications and requirements for them. And with the referral process, I would say that it's also based off of those who are identified as being most vulnerable as well. And they aren't necessarily flagged. So what it does do, though, is it adds them to the binding list, and we can see the different qualities that this household has that would make them be identified as a FUSE participant or FUSE eligible participant, as well as any other qualities that they might have, whether they're experiencing chronic homelessness, have a disability status, are they a family household, etc. And so it gives us an idea of what are the different factors that they have that make them the most vulnerable, so that they can be prioritized appropriately when resources become available.
Crystal said that she will pause her question for a future time so we can get to the last part here.
Rebecca, why don't we go on to the next slide here and just highlight what some of the next steps are in this work. So again, as we've been talking about here, as this work continues to progress, we're looking to continue to connect Built for Xero and FUSE. And one of the things that this is leading to is probably a need for a community-wide or system-wide conversation about prioritization, right? At present, FUSE is kind of a pilot program where we've taken one building here in downtown Grand Rapids and prioritized FUSE referrals for that building. Is FUSE an initiative that our community wants to prioritize significant, right? Do we want to integrate a coordinated entry process that always prioritizes FUSE clients across our entire community? Is there other populations that we want to give higher priority to or equal priority to? I think it's important that we as a community have a conversation about what our housing priorities ought to be, and design kind of processes that will ensure that we are reaching those individuals and then connecting them to housing opportunities as best we can once we have that. And is right at present, it's there is right multiple levels of prioritization where dwelling place may have a priority and somebody else may have a different priority. Do we want to continue to do that way, or do we want to develop some more systems-wide guidance around those pieces? I think is a conversation that we need to be having as we continue to address homelessness in our community here. Courtney, why don't you talk about the launch of the case conferencing model?
Yeah, so I wouldn't say that we necessarily have a specific model that's been discussed at this point other than system-wide case conferencing, but we know that that's an important component of both Built for Xero and FUSE. And we just need to make sure that all partners who not only serve frequent users, but who are engaged in our system are at the table. And it's really not just about that individual level case conferencing, but it's also about making sure that all the resources that organizations have available to them are within our system, so that we can ensure that anybody who is on the list can access them and be prioritized for them as well. And I think that that actually ties in directly with a lot of the conversations that we've been having around our coordinated entry redesign as well.
Thanks. And again, for those not familiar with the term, case conferencing is kind of right, is a term used when you start to have multiple organizations discussing a particular person or a particular individual case and identifying needs to house that person, but also about asking the questions around, are there individuals who our system is not serving particularly well? And how do you take what you learn about those specific conversations around individuals and translate that into systemic changes that ensure that we serve more people more effectively on a regular basis, right? It's about really kind of finding those systemic improvements to make the process work better for everybody by looking at those individuals that it's not working for right now and addressing the concerns that and challenges that they are facing.
Yeah, and I think it directly connects to Jeremy with that very last bullet point, the scaling with more partnership commitments and housing resources. Like that's a vital part of those case conferencing conversations.
Thanks. Yeah, and I think this is one where we recognize right now that the demand for and need for supportive housing exceeds our community's capacity to provide units dedicated for supportive housing right now. And so we are seeing more demand than there is supply. If we want to continue to scale, whether that's right, we could potentially look at scaling Fuse by having more of our existing units dedicated towards Fuse clients, and that would allow us to kind of meet more needs, but ultimately as a community, we need to find ways to increase the supply of affordable housing in general and supportive housing specifically. And there's some significant challenges to that. And so we are hoping that one of the next steps from that will be an interest in continued conversations around what we can do to expand those housing resources. One particular challenge that exists is that in order to, right, the most common tool for building support to build in affordable housing is low-income housing tax credits, and low-income housing tax credits require a 45-year commitment to providing housing. And so that means if a developer is going to build permanent supportive housing, they need to provide a 45-year commitment to having services available to the tenants that they are housing. And service providers do not work with 45 years of guaranteed funding. And so if we as a community are going to really kind of tackle this issue systemically, we need to find a collective way to ensure that support services remain available to housing developments that are dedicated towards support services in a way that gives everyone confidence to continue to put resources into the physical improvements, knowing that the social service side will be available to help do that. I think there's been a few examples in our community here over years where, because of significant state funding cuts, services that thought we would be available weren't available. And that kind of makes developers hesitant to dedicate future projects towards the same need, because that situation could happen again. And so how do we really come together as a community to have broad services that are available to a wide range of folks that allow individuals to be housed that need support services to be housed in a variety of housing types, right? Not just housing that is always dedicated towards permanent supportive housing. Is there ways that we can provide service delivery to other landlords in a way that gets them effective services? And I know there's been work done around that, but also how do we really attract resources from the state and federal dollars as they become available over the next while into creating more permanent supportive housing by having assurances that those support services will be tied in and available long-term for that. And so that's a very big and broad conversation, but we are hoping to make have continued dialogue around that, because as a community, we need to find some solutions to that. And so those are the three kind of high level, at least, next steps. There's obviously a lot of small next steps that are also continue to happen as we continue to move this work forward. And we are excited and glad that the city of Grand Rapids has been able to kind of coordinate and assist in getting data information around the justice side. And we're really excited to integrate that into our prioritization process in the short term as well. And so there's going to be continued work on multiple levels here, but these three big next steps are kind of big community conversations and community opportunities to help address some of the barriers and challenges that we're seeing right now. So our hour has come to an end very quickly here. So appreciate the time everyone has spent with us today and listening to updates. I will be on here for a little while if you want to stay around and continue to ask questions, but understand that many people have to go, and want to thank you all for being here, and also thank Tammy and Kim and Courtney for presenting today, and maybe give each of you a chance to kind of give some closing comments here before we go.
Yeah, thank you so much for that, Jeremy. I just really looking forward for us to have continued conversation about Fuse at the system level and ensure that we have integration across the board with other systems as well. So I would say, to answer your question, Nancy, about the best way to stay involved is we will be sending out an email with some updates. There are some specific items that we have on our to-do list that are more in the nitty gritty as opposed to at that high level. And so we will take care of those first. And then I would anticipate role as a community stakeholder for staying involved is to probably get involved with the continuum of care and ensure that you're part of the conversations and updates that we're having around ending homelessness at the population level. And we will be sure to send out those updates moving forward.
Kim, do you have any other comments or parting words for us as we wrap up our time together?
No, thank you. Only to say thank you for the opportunity to not only come and present today, but to work with this community. It's been great to see the teamwork and problem solving that occurs, how much communication is valued in this community. I think that there's more great work to come. I'm really excited about it, and please let me know if anyone has any questions about sort of the Fuse national effort as well.
I'd also like to extend a general thank you. I don't have specific information to share as Jeremy, Kim, and Courtney did, but still thank you. We appreciate the work that the community partners have done to implement Fuse over the past 2 years, knowing that it wasn't easy. And now we're already starting to see progress with continued progress going forward. So thank you.
All right. Well, thanks everybody. Like I said, I've got some time, so I will stay on here if you want to continue dialogue about this, but respect that it is 12 o'clock and you've all given an hour of your lives to join us here and had a virtual conversation with us today about this. So thank you all for your time and appreciate it.